Hello and welcome. Today we are jumping right into a couple of really high-stakes medical situations. These are moments where the most obvious choice, well, it isn't always the right one. It's all about what happens when skin gets broken, and literally every single second counts. So think about it. A deep, unexpected cut or a totally planned, routine surgery. What's the number one thing doctors are worried about? It's often the same invisible enemy, infection. So how do we stop it? Well, the answer is hidden in two very different stories, each with its own crucial rule. Let's start with a scenario where things have already taken a bad turn.
First up, we're in the middle of an emergency. Picture this. A construction worker has a pretty nasty accident on the job. And right now, the clock is absolutely ticking.
Okay, so let's paint the picture. Our patient is a 35-year-old guy with a deep cut on his forearm. Now, this is not a clean slice. The wound is full of dirt and grease from the construction site. To make things worse, nobody knows when he last had a tetanus shot. And you can already see the trouble brewing. The area is red, it's swollen, and it's bleeding.
Now, the blood work tells a really critical story here. His white blood cell count and his C-reactive protein are both elevated. Those are basically alarms going off inside the body, screaming that there's inflammation and a potential infection. His body's already in a fight. This isn't just a cut anymore, it's a battleground.
So, here we are at the crossroads. This is the big question for the medical team. What do you do right now, in this moment? Do you stitch it up quick, pump him full of antibiotics, wait and see what happens? Let's figure out the smartest move.
And the right call is to clean that wound like there's no tomorrow. Give him tetanus protection, and this is the really important part. Leave the wound open for now. I know it sounds a little weird, so let's break down exactly why.
So this whole strategy is built on three pillars. First, you have to physically clean everything out. That's called irrigation and debridement. You're getting all that dirt and gunk out of there. Second, you absolutely have to protect against tetanus, which is a huge risk with this kind of injury. And third, you delay closing the wound. You leave it open on purpose so that any infection has a way to get out instead of being trapped inside.
And this is exactly why the most obvious answer can be the most dangerous one. Your first instinct is to stitch it up, right? But doing that would just seal all that nasty bacteria inside, creating the perfect little incubator for a serious infection. Just using antibiotics won't work either, because they can't magically remove physical dirt. And just waiting? That's just giving the infection a head start. The big takeaway here is this. For a dirty wound, cleaning is way more important than closing.
Okay, let's switch gears. We're going from a reactive emergency to something completely different, a proactive, planned situation. This is all about playing defense, stopping an infection before it even has a chance to start.
So meet our second patient. She's a 50-year-old woman, and she's scheduled for a hernia repair. Now, this is a totally controlled, sterile environment, but she's got a couple of risk factors, type 2 diabetes and a high BMI, that make her more likely to get what's called a surgical site infection.
You can see here, her pre-op labs are all totally normal. Her body isn't fighting anything right now. So the entire game here is about one thing, prevention. How do we make sure it stays that way through the surgery?
Which brings us to our second big question. Given her specific risks, what is the single most effective thing you can do to prevent an infection from developing during her operation?
And you know, the answer is, once again, incredibly specific. It's not about a long course of medication or some complex procedure. It's all about a single dose of an antibiotic, where the timing is absolutely everything. This is the magic window. 30 to 60 minutes before the surgeon makes the first cut. Not hours before, not days before, and certainly not after. This very precise timing is the entire key to success.
This whole practice has a name, surgical site infection prophylaxis. And the goal is simple. You want the highest possible concentration of that antibiotic in the patient's tissues right at the moment the surgery starts. It's like putting up your strongest shield just seconds before the battle begins.
And that's why the other ideas just don't measure up. Giving antibiotics for days ahead of time doesn't really help more, and it can actually create antibiotic-resistant bacteria. Just relying on care after the surgery means you're already playing catch-up. And telling someone to delay surgery to lose weight often just isn't practical. That one single, perfectly timed dose is the proven gold standard.
So we've just walked through two really different scenarios, a chaotic accidental injury and a calm, planned surgery. So what are the big lessons here? Let's boil it all down to two core principles.
And this slide just says it all perfectly. On one hand, for a dirty, contaminated wound, mechanical cleaning is king.
You have to physically remove the threat before you even think about closing the door. But for a clean, planned surgery, it's all about proactive prevention. You get that shield up before the battle even starts. Two different problems, two brilliant solutions.
I think this quote just perfectly captures the wisdom from our first case. The ultimate goal isn't just to have a wound that looks tidy and closed up. The goal is safe healing. And sometimes, as counterintuitive as it feels, the absolute safest thing you can do is wait.
Which, of course, brings us to our final big picture question. These principles, aggressive cleaning and precision timing, they're fundamental to modern medicine. But as we face a future with drug-resistant bacteria and all sorts of new challenges, how are these core ideas of prevention going to have to adapt and evolve? That's definitely something to think about.